Welcome to True Health Tuesday, and the truth will set you free. We're actually going to get T-shirts like that. I think it's going to be fun. And plus the little, maybe, I don't know, go Brandon underneath there. We're going to get into foot and knee health. The second portion of this, the one that's I don't think will pass by the Ministry of Truth, is on losing a generation. But it sounds depressing, and it is. It is because of, the lack of precautionary principle being implemented in our government and our lives. But there's also a huge amount of hope, and we're going to get into that because the world actually is changing. Tyrants can't run unless the population goes along with it. And it turns out that there's a lot of free thinkers. Okay, so if you can get on the Dr. B VIP, that would be really appreciated. Victor doesn't work for free. But also, too, you get a chance to get the information and copy it, paste it, share it, get it out there. Because that's the big thing. Because eventually they will be shutting down all of the social media, and then I'll have to be on a box with a bullhorn in front of the parking lot. Now, Extreme Health Academy, I'm also going to be working with these guys this weekend. If you've had any chronic illness, disease, or anything, there are going to be a group of people in this group that have recovered from it or found solutions for it. So please get on there, support Justin and Kate. Knee and foot health. Why is that a factor? Why is that important for me? Well, because I've had some knee injuries. When I was 22, and this my contractor nephews and my nephew, who's a contractor, is in the audience, up on top of the second floor, so third floor, okay, the ladder is going down into the driveway of the basement, and I'm doing some woodwork up there. The ladder kicks out from underneath, slides down the wall. I land on the sidewalk, shattering my right kneecap. That hurt, okay? Then 8 years goes by, and I'm walking across the street. Bam, I get hit by a car, broke both my legs, my sternum fractured, skull fractured, front teeth knocked out. But I was a contractor, okay? So I had to work. I didn't physically use my body, but I mean, I was really, really hurt. And so I went to the medical world, and they were saying, look, we'll do a couple of operations on you. You'll be fine. We'll give you some drugs. Eventually, your knees aren't going to work. They're going to have to be replaced. Okay, and I said, well, okay, I saw the $6 million man. They said, no, these only last around 10 to 15 years. And I thought, oh, okay. And then I'm adjusted by this chiropractor. And it was actually one of the last jobs I had. And he was adjusting me while I was in the wheelchair. And he's saying, no, buddy, you ever cut yourself? The knees will regenerate. They'll grow. And I asked the medical world, and they says, nah, the cartilage has got a poor blood supply. It doesn't really grow. Then I found out that one of the drugs that they give, okay, and I found this out years later, non-steroidal anti-inflammatories actually destroy the building block of your joints, the building block of cartilage. No wonder they don't see it grow. And so I was so inspired by the chiropractor. Plus, it was hard to work. I went back to school, got my doctorate, and I found out that studying anatomy and physiology, because it was just like building plans. It was just like building stuff. And I thought, oh my God, human beings are amazing. They're tissue-producing machines. They give symptoms for a reason. But when you've had trauma, and this is physical, chemical, or emotional stress, we have this automatic nervous system. Now, I was actually having trouble passing human anatomy and physiology. And Dr. Chavez, who was a brilliant doctor, he said, don't worry, John. When you repeat the course the next time, you'll get it much better. And I thought, holy shit. Because I've been out of school for so long, and I couldn't fail. I had to pay for the school, for the first trimester on a pocket. And yeah, I missed a class. I'm done. Okay. So if anybody's been in a panic situation in school, oh God. But when we got to human dissection, it was amazing. Everything opened up. It made sense. It was like, my God, this is a tissue-producing machine. This is how the thing works. So when you're under stress, and this is physical, chemical, or emotional stress, and when we're talking about regeneration of cartilage, when we're talking about elimination of bone spurs in the foot, getting rid of plantar fasciitis, Okay, literally knocking that stuff out. It's not involved in just that joint. You got to look at the whole body. So if you're in a stress state from physical, chemical, or emotional stress, your body's not going to reproduce tissue. Or you're going to survive. You're going from trench to survive in the roar. So you got to look at the physical, chemical, or emotional stressors that are keeping you in that fight or flight state. You've got to balance that and rebuild the tissue through the parasympathetic nervous system. So you got to look at it. Now, when you're talking knee and foot health, do you have a beautiful, perfect gait when you have knee injuries or foot injuries? Duh. Okay, you're going to be walking like crazy. Now, the pelvis, the automatic nervous system, parasympathetic, half of it's in the pelvis, half of it's in the neck. Now, the pelvis, I've always described as perfect. There's no muscle that crosses the posterior back half of that, and you can see why. My gosh, you got ligaments going everywhere. It's amazing. Super strong and sturdy. Now, on the front of it, you've got the piriformis. Now, if you've been diagnosed with piriformis syndrome, okay, don't you love that? We don't know, it's just the will of the piriformis. It tightens up for some reason, we don't know why. It's ridiculous. Muscles don't react on their own, but the piriformis is the only thing that crosses that joint on the front side. So the body's trying to stabilize it. So we have to look at pelvic instability and the autonomic nervous system when we're talking about knee and foot regeneration. Why is this important? Because imagine if you're somebody that had compromised nerve supply to the foot. The foot's flattening out. It's always hurt for years. You've always had a little bit of a gait. And then you go to somebody and you say, look, man, I've got bowel and bladder dysfunction. You know, I cough and sneeze and there's urine that comes out. Or you know, it hurts when I sit or hurts when I stand. And you'll think, well, I never hurt anything. I did shatter my right kneecap, but I never hurt my pelvis. Okay, can you see how crazy it is? So you got to look at the whole thing. Now, pelvic problems, you're talking sitting can cause it, long-term low back problems, pregnancy, drugs, lack of movement. Now, here's a patient, and what I want you to do is look at the level line. Now, you're looking at the right leg and left leg. She's facing us. Now, she came from a developing country, and she got a polio infection, a suspected polio infection that affected her right leg, which is there. Now, what's interesting, I don't think it was that, okay, because her femur, the bone on the top is called a femur. That's the same length. It's not a different length of the other femur that's not affected. But the tibia below that was. And so the tibia is 35.75 millimeters too short. And so what that does, see the pelvis over there? It causes her pelvis to be at an extreme angle. Now, can this negatively affect how the body regenerates itself? Yes or yes? Absolutely. When you get a difference in the leg height, and the only way to tell is a standing weight-bearing X-ray, you're going to measure the height of the femurs. That's the only way. So if you've been told that you have a short leg, and the guy measured it by measuring from the pelvis area here, the anterior superior iliac spine to the medial malleolus, which is how they usually do it, forget it. It ain't accurate. It's worthless. Okay, because you can have a rotation of the pelvis that'll change that measurement. The only way is you're standing up, you measure that freaking area, okay? And then that'll tell you. Because when you got an 1.5 inch difference, it might be good. You don't want to raise it up the whole 1.5 inches. You want to raise it up about half of that, about 3/4 of an inch, and that's going to make a huge difference. But you can also see that there's less, it's like a discoloration. That means there's less bone density on the area because she's not really using it a whole bunch because it hurts and it doesn't work well. So we've got to look at restoring the nerve supply to it, restoring the biomechanics, and also the knee joints are hydraulic. They need fluid in there. And that fluid has to come from the superfiltrated blood called synovial fluid. So this has to get into that joint. But we're also going to look at the mechanics. So the joint's hydraulic, there's desiccation or drying up at that knee joint, and there's altered mechanics plus altered structure where the tibia, the lower one, where that femur rides in the top, is abnormally functioning. Now, this is hugely important because if you have an altered gait, I mean, and now that gal's got a significantly altered biomechanics, but if you have an altered gait where you're walking a little crooked because maybe you're missing dorsiflexion, maybe there's some kind of chronic issue, S2-3 floor keeps the ding dong off the floor. Okay, now that is a mnemonic. Okay, just like C3, C4, C5 keeps you alive, that's the phrenic nerve. S2-3 floor, that's the pelvic nerves, okay, that supply the pelvic floor. So looking at how important that pelvis is to stabilize, okay, knowing that that pelvic instability is directly dependent on how good your knees and feet are working. So here's a patient, chronic hip pain. Okay, why was the hip hurting? Well, when we did bending films, you can see the lumbar in there is shifted way off to the side. So in the completely dysfunctional system, no, stop talking about Anthony Fauci, okay? I'm talking the medical system, okay? No, it's not Brandon either, okay? God, the audience tonight, Jesus, okay? It's not the non-medical interventions that are completely ineffective. Look at the medical system. If you have bowel and bladder pain, if you have bladder incontinence, if you have sexual dysfunction, are they going to say, wow, let me check your gait and your pelvic stability? And we're talking just common sense. Look at the blood supply, nerve supply, and the function. Treat the patient as intelligent, and they're giving you symptoms for a reason. I mean, it just makes sense. What we did with her, and you can see the white lines on the sacroiliac joint there, that indicates inflation or inflammation. We gave her a little trochanter support before the adjustment, and it felt better. She says, oh my God, I wasn't leaking. I was giggling and it didn't leak. And this is huge because when you have pelvic instability, now we're talking about knee rehab. Knee rehab. If you have a knee issue, the pelvis is going to be unstable. How you check? You approximate the pelvis. Okay, you get on the back and squeeze it together. If that feels better, beautiful, you probably have an unstable pelvis. Then you get, and we get ours made in the USA. Why? Because I like USA. I was born with the idea that we had certain rights that couldn't be separated, and that we started, I just like this. So when we rebuild the country, okay, let's go back to the old Constitution. But this stuff is made local up in, I think, Oxnard. Now, it's a two-pole support. This is one, and then the other two pull tight. And it's super tight. You want it as tight as possible. Now, in the standard pelvic dysfunction, you're probably only going to need it for about a month, month and a half. Why? Because the pelvis is perfect. When you restore the biomechanics of the feet, you restore the biomechanics of the knee, you correct any disc injuries that are secondary to some pelvic trauma, bam, it works. Now, to do instant relief, you can sit kind of like a cowboy or a cowgirl. You turn the chair around. Why? Because when your legs go out wide, it approximates that sacroiliac joint and takes the pressure off. So if you do have an unstable pelvis, just sit wide. I know your mom told you not to sit that way. Look at the guys it would attract. So now here's a cool guy, okay? And when I say cool guy, bitchinest voice you ever heard. I mean, it sounds literally like God talking, if you could hear him. But what he did 20 years ago, he jumped off of a stage and he has bilateral healed compression fractures of his tibia. Now think of that. This guy jumping off, bam, breaks both his knees. Okay, the part that the femur goes into, and that's where that little ridge is there. Okay, that's huge. And this was 20 years ago. Then guess what? Still walks on them. Okay, so the cartilage was able to withstand that much battle. Now what's interesting, on the one on the left up there, which is actually his right leg, you're seeing that it looks like it's bone on bone. It's never bone on bone. There's always going to be a thin film of tissue there. But doctors will say this because they don't understand that cartilage can grow, meniscus can grow, and we're going to get into that, how it is. But what I was excited about is the tibia plateau, and that's where you got the femur coming up here, and it rests on that platform there. It's called a tibia plateau. That there wasn't a lot of distortion on that, so this guy could get the cartilage back. Okay, but we have to distract it. Now you might also see this little shadow up there that's way off to the outside. That's the patellar kneecap. So knowing that he damaged that You can actually see his lumbar on the far right there. It's, you know, he's a big guy, so it's a darker film, but it's bent off to the side. Now, the third lumbar supplies the knee. So if you damage the nerve that supplies the knee, are you going to have good knee function? No. Okay, so we're looking at the kneecap, which is off to the side. So he has an abnormal patellar tracking, he has desiccation or drying up of the knee joint, and he has an old fracture. But the joint's still pretty good, so he is going to get it back. He really is. Now, when we look at the foot has four arches, two run lengthways, two run crossways. But on the back of the calf is this muscle. It's called the soleus. And if anyone's ever taken a anatomy test, the two names of the Achilles tendon, one is Achilles tendon, the other is triceps surae. Okay? No, but you got to remember that because triceps means that there's three muscles that attach to it. You got the left and medial head of the gastrocnemius, and you got the soleus. The soleus is the pump. It's got veins inside of it. So this is one of the factors that allows a good blood flow in the lower leg, getting fluid to that. So when you're looking at altered biomechanics of the foot, you got to have those, the knee joints are hydraulic. So you got to have fluid in there. So if your foot isn't working right, if it's flattened out, if there's some kind of issue with it, bam, you're gonna have altered gait, but you're gonna have altered blood flow to that knee joint. So that arch of the foot is hugely important. Now, when you look at the foot, you can see that it's got a little arch on it. Okay, now the muscles in the foot are mainly there for walking and cushion and jumping around and everything else. But there's a band of tissue on the bottom called fascia, and it's on the plantar surface, so they call it plantar fascia. Okay, and this fascia it's so strong. It's actually really, really thin, but super strong. You can lift the whole body up just by grabbing the plantar fascia. But it's there as a secondary spring. So if you're really jumping off of a couple of feet, the muscles you don't want torn. So this fascia is in there just as a secondary support for big jumping or big weights. Now, if you flatten out or compromise the nerve supply to the foot, that big toe that's supposed to be going straight, maybe a little out, is starting to bend in. So when somebody comes in with knee problems, have they had an altered gait? Yes or yes? Is that going to negatively affect the pelvis? Yes or yes? Is that going to compromise the nerve supply to the foot? Absolutely. Is that going to put them in a stress state? Absolutely. So when we look at this, I'll say, wow, that bunion, the bone is not growing because you can see the x-ray next to it. Bone's fine, but the muscles around it are shrinking. They're atrophying. So bunion formation comes from compromised nerve supply to the foot, causing that foot distortion. And it turns out that the foot is actually a really, really good design. Now, you might say that the red shoes are biomechanically incorrect. I was raised with a mom who wore high-heeled shoes all the time and three sisters. If I tell them that high heels are bad for them, they're going to get pissed off because they're all short girls. Okay, so high heels make the girl's butt stick up. They make it feel pretty. Totally cool. Guys, gentlemen, do you like girls in high heels? Okay, so if you want to live, you're not going to say that's a bad shoe. Okay, what we're going to do is we're going to say we can fix the biomechanic problem of that shoe by stretching the calf and restoring the foot, restoring the biomechanics of the foot. This is the shoe that I wear. It has no arch support. It has just a hard rubber thing on the bottom, okay, so that I don't step on glass or anything else. And this is literally my work shoe, okay? And I have individual socks. Now, if you don't like this beautiful design of individual toes, yeah, the kids do think that my father was an orangutan, but they look kind of cool, okay? But they do have zero shoes that have full, they have just look like a regular shoe, but you need that full range of motion to do it. Now, it may take a while to start to restore that bunion or to get rid of that, to restore the muscle supply of the foot. But it's also what you got to do. Stabilize the pelvis, identify the disc injuries in the low back, restore the nerve supply to the foot, and then you've got to get the calf working correctly. And this is huge. And this is why we use this extremely technical device here. Okay, it's called a 4x4, which is really 3.5 by 3.5. Okay, I'm back when I was working. We actually had 4-inch by 4-inch. Okay, it was a little on the rough side. Okay, but this is just a block of wood, and what you'll do is you put the ball of the foot on there, the heel on the ground, and bend your knee, and the knee should literally go over the toe. So that is normal, but what you're going to see is a lot of people, particularly if they've gone through the current injectable medicine stuff, like most 18-year-olds, you're gonna see toe walkers. They won't be able to do it. They're gonna have upper motor neuron lesions. They're not going to be real stretched. Just know that in order to restore function to the knee, you have to have good dorsiflexion or movement of that foot. In order to restore biomechanics of that knee and that foot, you have to stabilize the pelvis and identify any disc injuries in the low back to restore the nerve supply. Does that make sense? Okay, you got to look at the whole thing. So if you're going to a foot doctor and they're only looking at their foot, they're not looking at how long your gait has been unstable, if that pelvis is off, if this created secondary disc problems, okay, find another doctor. Find another doctor, someone that's looking at the whole thing. Now, here's a gal, 50 years old. Okay, knee issues. But what's interesting is the side view over there on the right-hand side, that's a reversal of the lumbar curve. So she actually had a lumbar whiplash. Now, her knee joints are in pretty good shape, but the doctor said this was bone on bone. And I'm going, no, it's not. And she says, well, that's what he said. And I said, well, this is what it looks like. But you can see patellar tracking's off. The knee joint should be a little bit thicker than that, like about 15, 20% thicker. So do you think she has a dysfunction of the calf muscle or the soleus pump? Absolutely. And she has multiple disc injuries and a leaky gut. I mean, there's a bunch of stuff going on there. But if you're going to rehab the knees, you cannot look at the knee as in an isolated environment. Okay, so when you're rehabbing the knee, imagine every time you walk, what happens? That leg opens up and flies in the air, creating a negative pressure. Then you stand on it, then it compresses. So just the act of walking decompresses and compresses, decompresses and compresses. And that's how human beings move. It's a good design. I know, you can say, duh. Okay. But no, this is why. I mean, cultures have run, have walked, have done everything. And so when people say, well, I got bad knees because I played sports all the time and ran all the time. No, you're designed to do that. Okay, doing that by taking a toxic deficient diet or running with not looking at the appropriate biomechanics, okay, that will desiccate up or dry up the joints. So yes. Now, when we look at this, the knee, and that's the tibia plateau, or the femur comes down and it lies on this like flat plane here. It's not exactly equal. And in fact, the middle portion or medial aspect, the inside of the knee, moves twice as much as the outside. So it actually pivots on the outside. So when you're bending your knee, it's not going like this. It's going like this. Okay. It's pivoting twice as much. So when you're looking at a knee brace, which rarely do you need a knee brace, okay, unless it's to generate heat. If you damage something, it has to move twice as much on the inside as it does on the outside. So if you're getting a knee brace with equal hinges, that's completely abnormal. Now we're showing a standard exercise here where the person is dangling the legs. Now, we're putting 10 pounds on this, and she's a standard girl, probably 120, 130 pounds. Boy, she remembers, because this was a few years ago. She says that, and she's really 115. I'm going to get a ton of shit for that. Okay, always underestimate, gentlemen, whatever you think it is. And if I say, do I look fat in this? You say, no, you look good. So you're just dangling the knee, okay? You don't want to lift it up. So this is a ligamentous-based exercise. Now, when you're putting 10 pounds on each leg, you're going to just dangle it, okay? You do not want to lift it up. Now, you want to do it symmetrically, because if the person's had knee problems for a while, it's going to be changing how their brain views their body in space. So you're going to want to do it equally. Now, what you'll see in a lot of people who have had a chronic injury or illness, they're not going to be keeping an even rhythm. So a lot of times, if somebody has a balance issue or central nervous system problem, we'll have them tap something like the back of a trash can or back of a chair or something, so they can get that little bit of influence going back up into the brain. So it's gentle, slow, and easy. And that negative pressure is hugely important. Now, knowing that the medial part, that large curve, that large C-shaped section, is the meniscus, and that's usually the part that gets damaged. Now, it's interesting. If you find an ignorant doctor who doesn't know his butt from a hole in the ground, he'll say that the knee joint is avascular. And he's kind of right, okay, because where the femur hits, blood vessels would be crushed. But that meniscus is highly vascularized on the outside edge. Now, that meniscus is also connected to the medial collateral ligament, and the anterior cruciate ligaments also kind of helps hold that middle aspect together. So if you're clipped from the outside, bam, the medial aspect. So the terrible triad of Donahue is the medial meniscus, then the medial collateral ligament, then the anterior cruciate, and then that's a total blowout knee. That's what happens in football, sports, or, kicked by a jealous husband. So when you're looking at this, when you're doing that distraction where you have a 10-pound weight and you're dangling the knee, you can put your finger just on the inside of the knee, okay? And you'll feel the tibia moving and the femur not, okay? And you want to just put a little bit of pressure in there, about 1.5 to 2 pounds. And this is a non-surgical repositioning of meniscus. If your knee is chronic and it's bugging you, and it's because you haven't done the exercises or you're dehydrated, if you're just standing in the supermarket, you can put a little bit of pressure on it while you swing it back and forth, and that'll reposition the meniscus as well. Just know that meniscus will grow. Meniscus is alive. Meniscus has a good blood supply. And you can see the different tears there. All you have to do is approximate the tissue, bring it together, and it'll start to heal. Okay, now, when we're looking at this guy, L3 supplies the knee. Look at that x-ray over there. The third lumbar is the apex of the curve in that x-ray there. So L3 to the knee, L4 to the floor. It goes down to the floor. So if you compromise the nerve to an area, it alters the function of that area. Does that make sense? Yeah, I know. And you look at this. You're looking at digestion problems, headaches, fatigue, anxiety, sleep issues. Do you think that the structural component and the altered gait could be a contributing factor? Why don't they freaking look at it? It's just common sense. Now, patellar tracking, and this is the toughest one, okay? When you got the knee joint, okay, and it's sticking out, you got the patella on there, that kneecap. If you push into the body, okay, if you're pushing into that joint, that's going to hurt like the dickens. So you got to hook it, and you're not going to be pushing straight down. You're going to be pushing at a slight oblique angle about this direction. And that's going to check vastus medialis. You push the other direction, that's going to check vastus lateralis. And if it hurts when you're pulling this way, it means the muscle is so weak that you're able to move it far enough. And the chiropractor, if they're not skilled in this, they can look at some of our videos and we can go over it in detail with it. But what's wild is you can identify, okay, which muscle is weak. Now, this is an asymmetrical exercise because the vastus medialis is weak. We call it Charlie Chaplin, okay, where the legs are out wide. And this, you're going to do a full extension where you lift your legs all the way up with your foot turned out if vastus medialis is weak. Vastus lateralis is weak. I say it's Jerry Lewis, where you're putting the feet on the inside. Although Charlie Chaplin, most everybody that knows him is dead, and Jerry Lewis, most everybody that knows him is dead. So I've got to come up with a new analogy that contemporary people will understand. You guys know who Jerry Lewis is? Not a friggin' clue. Okay, good. I'll come up with something that works, okay? Because I do treat millennials. Okay. This gal here, when you look at it, reverse curve in the neck. Okay, that means she had a whiplash trauma years before. We're looking at desiccation of the knee joints. that's drying up. We're looking at flattening of the feet and knee pain. And when you look at this, the knee pain is just the alarm because her knee joint is not distorted. It's compressed, but there's not a lot of bony distortion there. Okay, so that means that it's just desiccating up. So that knee, anytime you got knee pain, it's an alarm. Unless you happen to be laying there and somebody breaks into your room and just beats you in the knee with a hammer. Okay, then it's probably just the knee joint. Okay, but if you're like regular living and you've had a torn ligament in your neck, which means there's a significant whiplash trauma, putting this person under extreme stress, possibly altering how they get their gait is and how they move, absolutely that's going to be a contributing factor. Does that make sense? Here's a gal, knee pain and hip pain. And I thought this was pertinent because when you look at the hip up there, you're going to see you got this femur head going in there, okay, and it's surrounded by a socket, but the socket looks a little odd. And this is one thing for doctors that are saying, well, it's degeneration, it's destroyed, it's damaged. Okay, you're looking at about 1/2 to 3/4 of an inch of bony growth there. Now that's about 15 to 20 years of bony growth. That means that this body, the socket, wasn't fully formed when she was. And I'm telling you about 60 to 70% of hip injuries, that socket isn't fully formed. Maybe in Carl Lewis or some, super Olympic athlete it is. But we see a lot of sockets that aren't fully formed. So what happens is over the years, the body lays down extra bone on that area in order to stabilize that. And so when I'm looking at about 3/4 of an inch of extra bone laid down to extend that socket, how long has your hip been hurt, miss? Oh, only about a year? Hell, it's not the hip. Okay, because this has been growing differently for 20 years. But most doctors, they're just looking for something different. If they find something different, that's the cause. It must be the cause. We can't look anywhere else. Okay, so do a little bit more detective work. And that was her 17 degrees before, 9 degrees afterwards. We utilize pre and post x-rays to document that we're actually fixing the problem. Knowing that 10% of the nerves that come off the spine don't have any pain fibers, it's a good idea to have an objective analysis to document it. Anyone who want to say, duh? Okay, how many doctors are actually checking their work? That would be cool. Okay, now we have this to turn sitting into therapy. Now this, I'm got pretty strong arms. I'm pressing it as hard as I can, and I'm barely compressing it. So this is pretty firm. You can also utilize an IKEA bottle of water, which has about a similar diameter. Okay, and where this is placed is the bottom of the elbow, is the bottom of the roll. So it's right at the thoracolumbar junction. Now, this is huge because we're looking at the lumbar, the low back supplies the nerves that supply the knee, supplies the feet. And there's always going to be a secondary thing. Why? Because you're walking funky, and the lumbar and the gait are all going to be the secondary. Okay, you've got to fix everything. So if somebody's trying to fix a chronic knee issue without looking at the pelvis or the lumbar, they're missing the big picture. So we're going to turn sitting into therapy. Why? This one goes back there for 20 minutes when you're sitting, take it out for 10 minutes. 20 minutes in, 10 minutes out. 20 minutes in, 10 minutes out. Anybody want to ask why 20 minutes? I'm going to tell you anyway. Okay, you all out. I'll tell. Okay. There's called a plastic elastic deformation curve that any material in the world, if you put it under a consistent pressure, it will maintain its original shape, kind of. That's the elastic portion. But if you put in any material, it could be wood, human tissue, anything, under a greater force for a greater period of time, it retains a new shape. Okay, so that's the plastic deformation. Turns out human tissue, if you put it under consistent force loading for 18 minutes, it maintains that shape. Okay, this is why, you hear all those weird exercises, only 20 minutes a day, that's all you got to do, just sign up for this. Well, this turns sitting into therapy. Now, the girls got it a little too low because you don't want it in the lumbar curve. You want it bottom of the elbow is the bottom of the roll. So the top of it's going to be like the standard bra strap, okay? If you're wearing bras, okay, don't want to ask your pronoun. Okay, good, good. Thank God. Okay, but it's going to be back there. This turns sitting, driving, it turns all that stuff into therapy. Hugely important. So look at the biomechanics, dangle the knee joint, but look at the pelvic stability, get everything working. And this is why when we put this stuff up and we put, what do you do for blah, blah, blah condition? What do you do for knee rehab, for foot rehab, for gait rehab, for lumbar rehab, for digestive recovery, which is what we're going to cover next week? Okay, you need proper nerve supply. You got to get out of the stress state into a normal autonomic nervous balance. And then you got to make sure the nerves that supply the knee and the feet are functioning correctly. Regular exercise, you got to move it. That's where the bunions go away. If you have a cloth on the ground and your heel is touching the ground, curl and lift your toes, curl and lift your toes. Walk barefoot in the grass or the hard sand. That'll work the intrinsic muscles, but you got to restore the nerve supply to it. So regular exercise like this, walking on the wet sand, is fantastic to reverse the bunions. But can you reverse the bunions by walking in grass or the hard sand if you haven't addressed the compromised nerve supply? No, the body doesn't work that way. So good nerve supply, regular exercise, proper nutrition. That means if man makes it, you don't eat it. Okay, sufficient rest, because that's when your body regenerates, and prayer and meditation. Does thought and prayer have power? Absolutely, absolutely. Just try it. There's enough data out there, okay, that shows that it works really, really well. Now, we're going to be moving on to the censored portion. Okay, so this is when I got to say goodbye to Facebook for today. We're going to come back next week. Hopefully, I'll have a chance to finish up the digestive disorder video. And you know, if you're on the Dr. B VIP, it'll move seamlessly into this. And next week to all YouTube as well. Now, Victor is going to be shutting this down in a second, but I want to show this one slide. Okay, now this is a National Informed Consent Exemption bill before Congress. And this is huge. And this is because if you were under the impression, if you were born in this country, that you had certain rights that couldn't be separated from you, and you're wondering that did anyone ever do a benefit analysis, a cost-benefit analysis of this, or the precautionary principle? To prohibit the federal government or state or local government from, or any other entity receiving federal funding from requiring citizens to be vaccinated, including federal agency requiring employees to take vaccination without citizens being fully advised in writing of all unknown or all known potential risk of the vaccines, and consult with the physician, followed by voluntary informed consent of the citizen, and for other purposes. And this is a cool bill. And if you think, well, those unvaccinated bastards should just die, you know, shouldn't you be involved in the choice? Should you be coerced? Should you be threatened? Should you, you know, for something that doesn't stop infectivity or transmission? You know, I'm just thinking, you know, maybe you should have the choice and be able to act like as an adult. And luckily, there are some politicians out there. So thank you very much. Hopefully that the Ministry of Truth will allow that. I did not write the bill. I'm just presenting the bill. Okay, just following orders, sir.